Good evening and welcome to our webinar, The Knee Pain Solution. I'm Dr. Pamela Frank, a naturopathic doctor. I'm so glad you could join us. This is our fourth webinar in the series. If you'd like to listen to the other two, just check out our YouTube channel. Just understanding your knees. Did you know that your knee joint is the largest joint in your body? It experiences a lot of wear and tear. Before we start discussing ways to treat and prevent knee pain, we're going to take some time to explore how your knees work. On a scale of 1 to 10, how confident are you in your knowledge of the structure of your knee? Just share it in the comments. So firstly, bones and tissues. Your knees are made up of 4 bones. The thigh bone, or the femur, which is at the top of the joint, that's your main bone at the top of your leg, and 2 leg bones, the tibia and the fibula. The fibula is a little bit to the side of your leg. It's a smaller bone. You can feel a little bit of a bump just below your knee, and the fibula is beside that is a bigger bone. On the top of the knee, a 4th bone, which is called the patella, or the kneecap, which slides into a shallow groove. There are 4 rubber band-like pieces of flexible, stretchy connective tissue that connect the femur to the tibia and help hold your knee bones together to create a movable, hinge-like structure that rotates as it bends. Because of its unique ability to rotate and bend, the knee is known as a swivel joint. Your knee is made of tendons, which are fibrous bands of tissue. These connect muscles to bones. There are 2 major tendons, the quadriceps tendon, which connects the long quadriceps muscles on the front of the thigh to the patella, or kneecap, and the patellar tendon, which connects the kneecap to the tibia. Both the quadriceps and patellar tendons enable you to straighten and extend your leg. Ligaments are connective tissues that connect bone to bone. Ligaments in your knee connect the femur or thigh bone to your tibia or shin bone and include the following. The anterior cruciate ligament, or ACL, is located in the center of your knee and controls rotation and forward movement of the shin bone. It's shaped like a cross and most likely to get torn or injured. As someone who's injured theirs while skiing, it's quite painful if that happens. The posterior cruciate ligament, or PCL, is located in the center of the knee and controls the backward movement of your shin bone. The medial collateral ligament provides stability to the inner knee, and the lateral collateral ligament, LCL, similarly provides stability to your outer knee. Knee pain is a common complaint among people of all ages. It can start becoming bothersome for a variety of different reasons. The most common causes of knee pain include inflammation, which is caused by improper lifting of heavy objects, poor flexibility, bad shoes, muscular weakness, pushing yourself too far with high-impact fitness routines, and structural knee problems such as arthritis, torn cartilage, or ligament damage. If you're currently dealing with knee pain, do you know what's causing it? Share it in the comments. Do you need surgery? Generally, people who are suffering from inflammation-related knee pain heal without resorting to surgery. Those dealing with less serious inflammation issues will be able to extend their knees straight without pain. On the other hand, people who have structural damage will have a lot of trouble bending and straightening their knees. Your medical specialist will be able to help you determine the seriousness of your injury. If you've been told that you need surgery or something else you consider too drastic, don't be afraid to get a second opinion. Our chiropractors, acupuncturists, naturopaths, and osteopath are here to discuss your options too. Just give us a call. You may assume that the best thing to do for your knee is to let it rest. However, staying active helps control your weight and builds muscle. Both of these help to protect your knees from further damage. If you're living with arthritis in your knees, strength training that focuses on building your quad muscles and your hamstrings decreases pain and helps you better tolerate the pain. You can also opt for non-impact aerobic exercises, such as walking on level ground, using an elliptical machine, a stationary bike, or swimming laps in the pool. Avoid activities that put extra stress on your knees, such as kneeling, deep knee bends, and downhill running. How do you stay active? Stretches that focus on your hamstrings and quads take the pressure off of your knees and kneecaps. People who skip the stretching or don't consider it a necessary part of their workout routine are missing out on all the protection that a flexible body offers. Warming up your muscles before diving into any physical activity prevents injury. You should start your activity at a slower pace before working up to full velocity. For your run, for example, walk or jog slowly for the first 10 minutes, or start by lifting a few rounds using 50% of the weight you plan to lift in your actual strength training routine. Try these exercises and stretches to get your body well conditioned. Step-ups. Stand in front of a small step stool or stairs and lift your body onto the step using one leg. Then step backward down the step with the same leg. Do 10 to 15 step-ups per leg. Hamstring curls. Lie on your stomach with your legs straight and your head resting on your arms or the ground. Bend one leg with the heel toward your buttocks. Repeat 10 to 15 times and then switch legs. Straight leg lifts. Lie on the floor on your back with one leg bent at a 90-degree angle and your foot flat on the floor. Lift the other leg off the ground. Repeat 10 to 15 times and then switch legs. Butterfly stretches. Sit up straight with the soles of your feet pressed together. Holding your feet, slowly lean your upper body forward, keeping your back straight. Hold the stretch for 30 seconds to 1 minute. And standing hip flexor. Get into a stride position, body and feet facing forward with one foot stepped further in front. Stand up straight with your abdominal muscles tight. Keeping your back straight, slowly lunge forward with the front leg. Hold the stretch for 30 seconds to 1 minute and then switch legs. If you're dealing with knee problems, watch your weight. Extra body weight has a huge impact on the stress that you put on all your joints, including your knees. Research has found that people who are overweight and have arthritic knee pain can lose about 20% of their pain with every 10 pounds of weight lost. Wear the right shoes. Wearing supportive and comfortable shoes plays a significant role in taking the pressure off your knee joints and promoting proper leg alignment and balance. When you're wearing a high heel, your weight-bearing line tips forward, so your quadriceps have to work harder to hold your knee straight, which then leads to knee pain. But if your heel is closer to the floor in low pumps or flats, your thigh muscles don't have to work as hard to maintain stability, which is easier on your knees. For exercise, find good quality sneakers and get professionally fitted by someone at a running or sporting goods store. Also, ask about shoe recommendations for knee conditions. You'll be surprised at how far sneaker technology has come. Having strong core muscles in your abdomen and lower back promotes good posture and in turn lessens the pressure on your knees. Exercises such as planks and back extensions strengthen your core. Try them out. For planks, you lie down with your toes pointed to the floor. Put your forearms on the floor with your elbows at 90-degree angles. Tighten your abdominal and gluteal muscles and lift your body off the floor. This will look like a push-up position, only you'll be on your elbows. Keep your back straight and hold for 15 to 45 seconds. Back extensions. Lie face down, flat on the floor, with your elbows bent and your hands on the floor. Keeping your hips on the floor, lift your head and shoulders with your arms. Hold for 5 to 10 seconds and repeat 5 to 10 times. Try Tai Chi. Tai Chi is an ancient physical and spiritual practice that offers many benefits. The practice increases your range of motion, helps with balance and flexibility, and strengthens joints and surrounding muscle tissue through low-impact movements. In a study published in Arthritis and Rheumatism, researchers found that practicing Tai Chi is especially beneficial for those with osteoarthritis. Have you ever tried Tai Chi? As someone who does karate, or kata are very similar types of movements to Tai Chi. Use yoga as a healing tool. Yoga is versatile enough that anyone and everyone can use it in their health and wellness routine. try looking for a yoga routine specific for helping with knee pain, or try a few classes and let the teacher know that you're struggling with knee pain. They'll provide you with a modified routine. Have you tried yoga? Would you try it? Personally, I love yoga. We'll be moving at the end of this month, and I'm so looking forward to having a bigger space in which to be able to do some yoga. Try a massage. By enhancing blood flow and circulation through massage, you'll relax your muscle tissue and soothe inflammation. Over time, this eases joint stiffness and increases range of motion in individuals who are suffering from arthritis, fibromyalgia, and osteoporosis. Chiropractic adjustments and osteopathic treatment help sore knees. They are most effective when combined with complementary corrective exercise. Knee pain is commonly caused by muscle imbalances and structural misalignment around your hip, knee, and ankle joints. This misalignment is brought on by poor posture, overuse and repetitive stress, and physical trauma. Chiropractic adjustments and osteopathic treatment of your hips, spine, and the patellofemoral joint mobilize the joints back into proper alignment for your body. This alleviates joint stress, reduces inflammation, and facilitates healing of the joint and surrounding soft tissue. When combined with corrective exercises that complement and reinforce your treatments, these help the treatments last longer and relieve pain better. If you haven't tried acupuncture to help with knee pain, it's certainly worth a shot. This ancient practice has been around for thousands of years. It has stayed popular for a reason. You would not persist with sticking needles into someone if this didn't actually help. By activating your body's natural pain relief system and stimulating your nerves, muscles, and connective tissues, acupuncture provides relief for joints that ache. Make sure that your acupuncturist is properly trained and registered with their regulatory body. Our acupuncturist, Joy Walraven, combines Chinese herbal medicine, craniosacral therapy, and acupuncture treatments to help with knee pain. Try some supplements. The most popular supplements for arthritic knee pain are chondroitin and glucosamine. Both substances are found naturally in your body. Chondroitin sulfate helps to keep cartilage from deteriorating. Glucosamine stimulates cartilage formation and repair, so you're rebuilding the cushion in your joint. There's a lot of evidence that they work, but only in a certain percentage of patients. Other supplements that have been shown to reduce inflammation and pain include turmeric. The active ingredient in turmeric is curcumin, fish oil, and ginger. You might also consider incorporating a multivitamin into your routine, as the vitamins and minerals in it will help enhance healing and recovery. Keep in mind that these supplements usually take about 4 weeks of regular use before you'll notice any dramatic difference. Food is medicine, so create a diet that helps to reduce inflammation. Choose whole grain starches, fresh whole fruits, and vegetables. Consume fruits and vegetables in copious amounts and eat a variety of colors. Limit refined starches and sugars like white bread, soda, candy, and energy drinks. Choose lean proteins like chicken, turkey, fish, eggs, beans, and fat-free Greek yogurt. Limit high-fat red meat like burgers, bacon, and sausage, as well as processed meats like bologna, salami, hot dogs, and lunch meat. Eat your omega-3s by incorporating more olive oil, avocados, nuts, salmon, tuna, and flax seeds. For more diet advice, talk to our registered dietitian, Sanaz Baradaran. After an injury, don't be shy about using a crutch or a cane to help you walk around with. It'll take the stress off your knees and help you heal faster. A splint or brace might also help you keep you stable. Inquire with your health specialist to see what's best for you. Thank you so much for taking the time out of your busy day to join us for this webinar. We love getting to chat with you, and we hope that you all learned something valuable over the last hour. If you have any further questions, please post them below or email us at info@forcesofnature.ca. We're always here to answer your questions, and if you have any feedback about the webinar today, we'd also love to hear it. For help with knee pain, you can call us at 416-481-0222 or book an appointment online anytime on our website at forcesofnature.ca. As far as help for knee pain, we have two chiropractors, Dr. Darlene Bowen-Bassett and Dr. Brandon Davey. We have osteopath Peggy Jamali. We have registered dietitian Sanaz Beradaran. And we have two naturopathic doctors, Dr. Rochelle Vong and Dr. Pamela Frank, myself. And we have an acupuncturist, Joy Walraven. Any or all of us would love to help you with knee pain. Reach out to us anytime at 416-481-0222 or email us at info@forcesofnature.ca or visit our website for more information at forcesofnature.ca. Thanks again.